CPT JJ-CPB Introduction, page 15, part 2.
Okay. Place of service and facility reporting.
Place of service and facility reporting. It means where is the procedure done, right? Some codes have specified places of service. For example, the E&M codes, evaluation and management codes, are specific to a setting. It means where it is done, it's important. Where was the procedure or the service done? In the doctor's office, in a hospital, as an outpatient, as an inpatient. That is the place of service. Where, right? Other services and procedures may have instructions, what? Specific to the place of service, right? For instance?
Therapeutic, prophylactic, diagnostic injections and infusions.
And infusions, right? And now, let's concentrate a little bit in what are E&M codes, okay? E&M codes are evaluation and management and are a subset of the CPT codes. Those are one of the sections of CPT. The first section is E&M. What are E&M? In first place, they apply to everybody. Privileged providers means all the providers who use CPT, right? And it describes the complexity of care, the place of service, and the type of service, right? So he has three components: the patient's history, the physical examination, and the medical decision making. Basically, what this is just classifying what kind of service and where and what action was taken in regards to the patient, right? This is just, as the name says, evaluation and management. You evaluate the condition of the patient and then you manage the disease or the taking care of the disease, okay? So those are E&M codes, and they, of course, have a lot to do of where they are done. That's why they're a function of the place. They change if you change the place. All right? So that's our theory for today. Now let's do a problem. So ready, set, go. All right. CPT JJ-RVA-264. That's the page 264, the exercise 118. And this is a level 0 exercise, which means that they're very easy. Okay? If you know very little about coding, do this one. You will find it very easy to do it. Okay, the title is?
D&C, postpartum hemorrhage.
D&C, postpartum hemorrhage. And D&C in your medical terminology is dilation and curettage, right?
Right.
Okay, now the text.
Now the text is surgery, maternity care and delivery. A D&C performed for postpartum hemorrhage.
A D&C is performed for postpartum hemorrhage. That is the procedure, okay? So we're going to count to 3 so you can give us the CPT code for this procedure. 1, 2, 3. Okay, the answer is 59160. Okay? You got that? 59160. If you got it, congratulations. If you didn't get it, let's give you a tip. We only have one tip because this is very easy. So what's the tip?
The tip is start with dilation and curettage.
Right, start with D&C, which is dilation. All you have to know is that D&C is dilation and curettage, right? And a little medical terminology should have already taught you that. All right, so start with dilation and curettage, go to the index to the D and look for dilation and curettage, and you will find that there's just one more step and you get to the code, right? So the answer is 59160. So we're going to count to 3 so you can pause the video and then give us the path, how we got to the answer. 1, 2, 3. Okay, this is the whole summary of the problem. This is a surgery section of the CPT code. It's a maternity care and delivery, and it's a D&C is performed for postpartum hemorrhage. Okay? So a D&C is a dilation and curettage. There's only one code, and the code 1 through the index is found like this.
First, you go to index.
Go to the index.
Then you go to dilation and curettage.
Start with the D, letter D, A, B, C, D, and look for dilation and curettage. And then?
Then you go to postpartum.
Postpartum. There's no hemorrhage, but there's postpartum. Anything postpartum is included here, right? And the code is?
Code is 59160.
59160. So you're going to check this in the tabular, right?
Right.
So the code 1 through the tabular is checked like this.
First you go to tabular.
Go to the tabular.
Then you go to 59160.
59160, and what is that?
Curettage.
Curettage, and is?
Postpartum.
Postpartum, which is exactly what we have, right? Curettage, dilation and curettage is the same as curettage, right?
Right.
And that's why we have an equal sign at the end, right?
Right.
An equal sign at the end, and the answer is 59160. Okay, so thanks for watching, and don't forget to visit our website, and also
you can subscribe to us on YouTube by clicking here for our new medical coding videos.
Alright, just click the subscribe red button and you will get
up to 3 videos every day that we make. ICD-10, CPTs, all that's needed to pass the medical coding certification exams.
Okay, so thanks for watching, and don't forget to visit our website and subscribe to our videos. Thank you.
Bye.
Bye.